Tuberculosis is an infectious bacterial disease caused mainly by Lactobacterium tuberculosis. It normally attacks the lungs, resulting in coughing, fever, and chest pains. It is the second principal cause of death, killing approximately 2 million people every year. The earliest archaeological evidence of the disease was documented by ancient Egyptians. Scars of tuberculosis have been found in the bones of Egyptian mummies and are visibly illustrated in Egyptian paintings. Hippocrates described tuberculosis as a fatal disease of the lungs characterized by the symptoms of coughing, fever, and affecting people between 18 and 35 years old. He also believed tuberculosis was hereditary rather than infectious. In the 18th century, tuberculosis incidence increased, reaching epidemic proportions, particularly in Europe, where mortality rates were between 1,000 and 100,000 annually. It was the most common cause of death at the time, and it was known as the white plague. The history of tuberculosis changed when the German microbiologist Robert Koch made his historic lecture in Berlin on March 24, 1882. In this lecture, Koch demonstrated that tubercle bacillus was the cause of tuberculosis. In 1819, Dr. Koch made another lecture where he claimed to have found a cure for tuberculosis, tuberculin. However, a true cure for tuberculosis had to wait until 1943, when streptomycin was discovered by Professor Waskman and his assistants. Meanwhile, a vaccine for tuberculosis was developed in France by Albert Calmet and Camille Guérin, who first tested a formula containing an attenuated form of the tuberculosis bacillus, known as Bacillus Calmet-Guérin, in 1921. In the early to mid-20th century, mortality rates of tuberculosis started to decrease. However, in the 1980s, with the arrival of HIV/AIDS pandemic, mortality rates increased once again, and consequently, interest in tuberculosis research and prevention. In 1993, tuberculosis was declared a global emergency, and DOTS was developed. The DOTS program started officially in 1995, and by 2005, 189 countries were using the program. 26 million people were treated under the DOTS program. The tuberculosis incident rate became stable for the first time. The global case detection rate increased from 15 to 62%.
Epidemiology. TB is prevalent in a third of the world's population. It affects more than 2 million people. In 2012, there was an estimated death toll of 1.3 billion. Individuals who are at high risk of developing tuberculosis are those who have been infected with tuberculosis and with those who have medical conditions that weaken their immune system, such as HIV. Other factors that can increase chances of developing tuberculosis include malnutrition, smoking, lack of respiratory infection control, and poorly ventilated areas. Although there are many new cases of tuberculosis, in 2013 there was an 86% treatment success rate.
Etiology. Tuberculosis is caused most often by Mycobacterium tuberculosis, which is a slender anaerobic rod shape. The bacteria grows slowly, about 20-hour generation time, form filaments, and tend to grow in clumps. About this structure, there is a waxy cell wall composed by unusual glycolipids and lipids, such as mycolic acid, which makes the bacteria acid fast. So, on the treatment with a mixture of acid and alcohol, the bacteria retains things, which makes them weakly gram-positive. About the pathogenesis, before 3 weeks, when an immunocompetent person inhales some bacteria, some of them can avoid the local defenses in the upper respiratory tract and then reach the alveoli. There, an inflammatory reaction begins because bacteria enter into macrophages by phagocytosis, which is mediated by several receptors. Then, the bacteria block the formation of phagolysosome, and this allows the proliferation of the bacteria. And this proliferation occurs in the pulmonary alveolar macrophages and air spaces, resulting in bacteremia. After 3 weeks, a T-cell response initiates, and the T-cells activate the macrophages, enabling them to become bactericidal. So, some of these macrophages can also differentiated into epithelioid astrocyte and aggregates to form granulomas, and it can cause caseous necrosis in the middle of this granuloma.
TB is an airborne disease. An infected person with TB can spread the disease by aerosol transmission. For example, coughing, breathing out and sneezing are some of the ways. Small amounts of the bacteria inhaled is sufficient enough to make a victim infected. However, not all infected people develop an active disease. When the immune system fails or weakens, bacteria will break out and multiply in numbers. It initiates in apical segments, part of the upper lobes in the lungs. Localized consolidation is caused due to the proliferation of the bacteria, triggering an inflammatory response. This results in tissue necrosis and formation of tuberculosis cavities. Lung lesions may cause further complications, including pleural fibrosis and adhesion, rupture of caseous lesion, and spreading to other sites in the body. Extrapulmonary tuberculosis. Outside the lungs, tuberculosis infection is more common in immunological disadvantaged patients and young children. Organs such as kidneys, regional lymph nodes, genital tract, and brain are normally involved. Complications are serious due to the increased load of tuberculosis bacteria taking advantage of the debilitation of the patient. For example, scarring and necrosis of the kidney, pelvis, ureters, and bladder are all due to renal tuberculosis.
Signs and symptoms of tuberculosis. The symptoms of tuberculosis range from no symptoms to symptoms. There are two TB conditions. Latent TB infection is a condition in which the Mycobacterium TB remain in the body in an inactive form, causing no symptoms. Latent TB infection can, however, develop into TB disease as the immune system weakens and is left untreated. TB disease most commonly affect the lungs, which is called pulmonary TB, causing symptoms such as a prolonged coughing along with the production of sputum, coughing up blood, chest pain, night sweats, fever, difficulty breathing, and weight loss. TB disease can also affect other parts of the body. This is called extrapulmonary TB, causing symptoms like those with pulmonary TB but with additional complaints specific to the infected area. Anyone with, for example, anyone with TB in their lymph nodes will experience a swollen throat, whereas patients with bone TB would experience pains and aches in their joints. Now going to the diagnosis of tuberculosis. The diagnosis of tuberculosis is based on the information obtained from the medical history, physical examination, test results, chest radiograph, and sputum sample results. Two common tests known as tuberculous skin test and TB blood tests are used to determine whether a person is infected with TB. Tuberculous skin test is implemented by injecting a small amount of tuberculin into the inner surface of the forearm, and the reaction is examined within 48 to 72 hours. The formation of the solid red bump at the injection area will conclude an infection.
Mycobacterium tuberculosis have the ability to undergo random chromosomal mutations. This makes TB infection incredibly difficult and costly to treat. To effectively eradicate TB infection, patients must completely comply to their treatment plans the entire duration of their treatment. Streptomycin was the first antibiotic that was used to treat TB in 1945. However, the use of this was quickly discontinued due to resistant bacteria. Pulmonary non-resistant TB is treated with a combination of drugs. Patients are prescribed isoniazid, rifampicin, ethambutalol, and pyrazynamide for an initial phase lasting for 2 months. This stage is to kill the rapidly dividing bacteria that are present. This is then followed by a continuation phase lasting for another 4 months of rifampicin and isoniazid to kill the slowly metabolizing bacteria. Drug resistance. Multi-drug resistance TB is caused by either incomplete treatment has been interrupted, or TB treatment inaccessible. Treatment will be chosen depending on what antibiotics the bacteria are resistant to. It will consist of first-line oral antibiotics, a fluoroquinolone, an injectable anti-TB antibiotic, and second-line anti-TB drugs. The length of treatment will be based on the patient's response to the therapy. Prognosis. With the correct therapy and adherence to treatment, the prognosis for TB infection is good. Over 90% of patients recover from the infection with minimal complications. A delay in diagnosis, incorrect medication, interrupted treatment, and resistant bacteria are all issues that contribute to fatal outcomes of TB infection.
tuberculosis using drug susceptibility testing and screening, ensuring all individuals with tuberculosis are treated, collaborative tuberculosis and HIV activities, vaccination and prevention treatment, and education on TB. Prevention for workers in healthcare settings include isolation of tuberculosis patients, respiratory masks, any specimen containing the microbacteria must be appropriately labelled, and any sputum must be put in a sputum container with tight lids and discarded until we get a clinical bag.